Hello, I'm Emma Hammett from First Aid for Life and onlinefirstaid.com. Today we're going to talk about epilepsy, seizures, convulsions, fitting, and how to help if you are first on scene and you find somebody who is suffering a seizure. A seizure is the medical term for a convulsion or a fit. And a convulsion, a fit or a seizure are when the electrical activity in the brain gets disturbed for some reason, and instead of working like it normally does, it fires off random messages which, depending whereabouts in the brain it's happening, can cause you to have rigid movements, to be out of control type movements, absent seizures, and any of the sort of seizure-like activity that you might have witnessed before. So seizures are incredibly common. About 1 in 20 of us will experience a seizure at some point in our lives. And they can be caused by all sorts of things. Most commonly by a drop in oxygen or the blood supply to the brain. And that can be for all sorts of reasons, from a bang in the head, for a brain tumour. If somebody has fainted, it can sometimes appear as though they're having a seizure. Again, that's because of the reduced oxygen supply to their brain at that point. When someone has a cardiac arrest, it's quite common that they have a seizure at that time. So really important that you are checking whether or not the person is breathing. Malaria can cause seizures. A stroke can cause seizure-like activities. Alcohol, drugs, raised temperatures, all sorts of things can cause a seizure to happen. And a diagnosis of epilepsy is given when someone has had at least one unprovoked seizure with no identifiable cause. And there's about 600,000 people diagnosed with epilepsy in the UK, and that's about 1 in 100 people. So there's all sorts of things if you are epileptic. So seizures are one thing, and seizures are something that happens when you are epileptic. So seizures, 1 in 20 of us will have a seizure, but you can be diagnosed as being epileptic, and that can happen following seizures. So if you are epileptic, quite often or usually you're given medication to manage your seizures. And that medication can be quite difficult to tolerate sometimes. It's much better than it used to be. But if you're on that medication, you need to take it regularly. And there's various implications if you are epileptic that you need to consider in your day-to-day life. Most people, they control their epilepsy and they are able to carry on and have a completely full and normal life. A few considerations though. Think very carefully if you are doing particular types of work. So if you're doing work where you're involved in dangerous machinery, then that's potentially more risky to yourself and others if you are epileptic. And the DVLA will also want to know if you are epileptic. And if you have been free from seizures for the last 12 months, they will usually issue you with a 3-year license, providing you're taking, you're being regularly monitored and seen by a doctor, and you're adhering to their instructions. If you have been free from seizures for a full 5 years, they will then usually issue you with a full license until you're 70. If you find somebody who's having a seizure, it can be very alarming if you're not used to it, and that's the first time you have experienced somebody having a seizure. It depends what sort of seizure they're having, because depending whereabouts on the brain that is affected, sometimes they are little more than sort of absent seizures, where they're just having a sort of blank moment for a minute, and they may not even be aware that that's happening, to a full tonic-clonic type seizure, which can be very frightening. If you see someone having a tonic-clonic type seizure, quite often it can start with a sort of scream. And that is not them in pain, that's the muscles tightening up and expelling the air, which can sound like a scream. Now, if the person has had seizures before, it may be that they have a moment or two, an aura, which is a sound, a taste, a smell, that tells them, uh-oh, I think this is about to happen. And they may look to you for help. If the person then ends up collapsing down, if you're able to catch them without hurting you, lower them gently onto the floor. If they're on a chair that they're likely to fall off, get them again onto the floor if it's safe for you to do so, and otherwise look after their safety where they are and where they're having the seizure. Look at your watch and time it. It's important to time it if you can, because if a seizure lasts for more than 5 minutes, or if they're repeated seizures, whilst someone's having a seizure, they're not as able to circulate the oxygenated blood to their brain as when they're not having a seizure. And so consequently, if it's more than 5 minutes, that's 5 minutes with a reduced blood supply to the brain. So really important that you get the emergency services on the way. And if it is someone who is epileptic and has medication to control their seizures whilst they're having a seizure, so a very specific type of medication, that you are able to give that if trained to do so. So loosen their clothing if there's anything that's going to constrict them or cause any problems whilst they're having a seizure. Cushion their head and make sure anything that they could injure themselves against is moved away from them. Move it away from them rather than moving them away from anything they can bash against. Look after their dignity. Really important. If there's onlookers, move them away and just make sure that whilst they're having their seizure, that you are protecting them. As soon as the seizure has stopped, check their breathing. If they're unconscious and breathing, pop them in the recovery position. If they're unconscious and not breathing, you may well need to do CPR. Remember that a cardiac arrest can look like a seizure, so if they're unconscious and not breathing, don't delay doing CPR, get the emergency services on the way. Now, if they've been having a seizure and you have put them in the recovery position and they start to come around in this what's called a post-ictal phase, they might well be a bit confused. They will be exhausted. They may be tearful. They could be a bit aggressive. They've had one heck of a lot of shake-up going on in there. So just be ready to be as reassuring as you possibly can. Again, continue to protect their safety and get an ambulance on the way, particularly if it's the first time that person's had a seizure, or if you don't know the person, get an ambulance on the way anyway. If it's somebody who has repeated seizures, and this seizure is a little bit different, again, get an ambulance on the way. If the seizure lasts more than 5 minutes, or if it's repeated seizures, or if they take more than 10 minutes to start coming round afterwards, again, if you haven't called an ambulance, get one on the way. And whatever you do or don't do, please don't let anybody put something in their mouth, and keep your fingers well clear of their mouth as well. The old style where people used to try and ram something in their mouth to stop them biting their tongue hopefully has long gone. But if anybody is trying to do that, please make sure that they're not. If the casualty does bite into their tongue whilst they're having a seizure, then that can be sorted out once the seizure's happened, and ramming something in their mouth will not help it. That's Emma Hammett from First Aid for Life and onlinefirstaid.com.